the cluster of Rehorst. And then one of the most important parts of the cluster of Rehorst is the search for aberrant motions. And this search will be during the performance of Adams test. And then in this case, the Adams test is not performed to see scoliosis, change in the structures, and the bone appearance of the vertebra. Is used not to see distortion, is used to be like a search for different patterns of motion, relating these patterns of motion with instability or pain. Okay, and then one of the first manifestations of that is visualization of instability, and I ask the patient to do the Adams test, and some patients during the Adams test will show step-off vertebra, and this step-off vertebra is a sign of instability. Another possibility is when another manifestation that may appear in the cluster of Rehorst in this test, in this search of aberrant motion, is when I ask the patient to make the flexion, and the patient have a decelerating or accelerating. Go again. Go. And the patient, due to the pain, he decelerate or accelerate. Go again and accelerate. Yes. This type of manifestations means possible instability in the lumbar spine. Okay? And after that, another possibility is having antalgic reaction, and the patient due to the flexion will manifestate an antalgic situation that will localize pain, for example, in the back, like that. Another possibility in the search of aberrant motion is the goal sign. Is when he performing the flexion, he will grab on the legs and try to escalate himself, and this is the goal sign. This is another sign of instability that we check on the. We may check this in the search of aberrant motions due to the cluster during the cluster of Rehorst. Okay. Perform the straight leg test. And the straight leg test is not performed to see pain. Okay, if the patient have pain, you can take a note of it. But the aim of the straight leg test is check if the patient have more 90 degrees or more than of flexion. And if it's the case of 90 degrees or more in flexion, this means a chance to be a patient with hypermobility. And then this is indicative to perform the Baton score. Fundamental part of the cluster of Rehorst is the spring test and comparison with the prone stability test. And then we ask the patient to lay down on the table like that, and we check for the pain area in the lumbar spine, making a little bit of pressure in the spinal process or in transverse process, and you go from S1, L5 until, for example, until the end of the lumbar spine is L1. Okay, we check every segment for pain or discomfort, and then if the patient say that there is a pain in L5, we mark that. And we go for another phase that is prone stability test. And the prone stability test, I will do the same type of pressure, but now I ask the patient to raise the leg, okay? And then if the patient in the spring test refers pain in L5, for example, L4 and L5 here, I check again the same movement in the spring test, in the prone stability test, when the patient is with the leg raised. And I go and make the pressure here, and then ask the patient to relax. And then I question the patient, do you feel the same pattern of pain? If the patient say, yes, I feel the same pattern, the answer is the contraction of the muscle didn't diminish the pain. And if I ask the patient and the patient say, oh, I diminished my pain, means that the strengthening of the muscles diminished the pain. And then the cause in the second case, and the cause of the pain, lumbar pain in the patient, may be related to instability of the muscles. And then hypermobility, segmental hypermobility, or functional instability. I am not talking about structural instability. I'm talking about different patterns of motion that are related to the dysfunction, and especially dysfunction with weakness of the segmental muscles. And then someone asked me if the patient cannot perform prone stability test, and then our strategies will be focused in the pain control. After the pain control, we will again do the test, and when the patient are able to perform this test, and then we have the diagnosis if we go for techniques of manipulation, chiropractic, osteopathy, or we go for example, strengthening techniques like segmental, functional strengthening, and some techniques that increase the stability of that area.